Hospital Association. Welcome to our webinar this morning on voting rights in the age of COVID-19 for residents in long-term care settings. We will spend the next hour hearing from the New Jersey Office of the State Long-Term Care Ombudsman, Disability Rights New Jersey. And we also have with us the New Jersey Department of State Division of Elections and the New Jersey Department of Health to assist with any questions that may arise in their areas. We have a very large group of attendees this morning. So when we get to the Q&A portion of the presentation, I am going to ask that you please use the chat box on the WebEx that's on your screen, not the Q&A box, the chat box, so that I can make sure that I see all of the questions that are being asked. I will read them aloud. We will ask the presenters to respond to the questions that pertain to their area of expertise. And if there are any questions that cannot be answered today, we will take them back and work with the faculty to get responses for you. So with that, I am going to turn things over to Lori Brewer, the New Jersey State Office of the Long-Term Care Ombudsman. And Lori, I just want to know if you'd like me to make you the presenter
yes.
So that you can advance the slides.
No, if you don't mind, could I just ask somebody else to do that?
I'm happy to do it for you, no problem.
Yeah, I do appreciate that. Okay. Thank you so much. Right. Thank you so much, Teresa.
You're welcome. Please go ahead.
Thank you, Teresa, and thanks to the New Jersey Hospital Association for hosting this important educational program today. I want to thank our partners at Disability Rights New Jersey and the New Jersey Department of Health and the New Jersey Division of Elections for their assistance in putting this program together. Obviously, COVID-19 has changed how Americans will cast their votes across the country, and nowhere is that more evident than in the long-term care community. The restrictions that are in place regarding visitation, movement within the facility, and residents' limited ability to leave places tremendous responsibility on facility staff to help residents exercise their constitutional right to vote, and that this is amidst all of the other things that facility staff are having to do. And I know that many of you are working diligently on this issue. We hope that you find this program illuminating. Next slide, please. The basis for this webinar is voting guidance that is available on the Long-Term Care Ombudsman website under Publications and under Information for Facilities. The name of the document is Voting Information for Residents and Long-Term Care Facilities. Our website is www.nj.gov/LTCO. This guidance was created with input from all of our partners that I just mentioned. It was emailed to providers, to provider associations, shared on social media, and it was sent in newsletter form to residents. This was all done during the first week of October. Next slide, please. The main points that we will be covering are voting rights in long-term care, the 2020 voting processes, somewhat different than previous years, making a plan in your facility, communicating with family and residents, and understanding voting rights and accommodations for people with disabilities. Next slide, please. First, the right to vote is one of the most sacred privileges in a representative democracy, and it should, without question, be available to all residents. Living in long-term care does not diminish, but in fact enhances this right. Indeed, the Centers for Medicare and Medicaid issued guidance on October 5th that affirmed the continued right of nursing home residents to exercise their right to vote. The CMS guidance further makes it clear that the resident has a right to be supported by the facility in the exercise of voting. This guidance goes on to further state that any infringement of a resident's right to vote is a violation of residents' rights under federal law and federal nursing home regulations. And as mentioned earlier, given the current visitation restrictions, residents will be more dependent than ever on staff to help them vote. And I want to thank you for what you have done and what I anticipate you will do to help people vote in long-term care. So you need to have a plan to communicate that, and you need to communicate that plan clearly to maximize voting. I'm now going to turn the program over to Mary Saccone, Policy Director for Disability Rights New Jersey, who will provide some specific details on the processes for voting this year.
Hello, everybody. Next slide. In order to vote in New Jersey, there are 4 requirements. 1, you must be a U.S. citizen. 2, you must be a resident of the county where you're registered. 3, you must be 18 years old. And 4, you must be a person not serving a sentence of incarceration as a result of a conviction of any indictable offense, either in New Jersey or another state. Next slide, please. In New Jersey, the deadline to vote in this upcoming election passed last week on October 13th. But you can still register to vote in future elections by visiting the New Jersey Voter Information Portal at www.nj.gov/state/elections. Staff can help residents register, but anytime someone helps, they must provide their name, address, and the date they filled out the form for the applicant. And there is no limit on how many residents a staff member can assist in this way. If you're not sure whether you're currently registered, you can go onto the voter information portal and check your registration status online. Next slide, please. For this upcoming election, the process has changed. In the past, in order to get a mail-in ballot, you would have to put in an application for a mail-in ballot. However, for this election, due to COVID, the governor put out an executive order that changed the process. Now, all New Jersey counties were required to mail ballots automatically to every active registered voter by October 5th. So at this point, every active registered voter in New Jersey should have received their mail-in ballot. The mail-in ballot was mailed to the registration address. So if you've registered in another location as your primary home address, but you're currently residing someplace else, that mail-in ballot would have been sent to your primary address. So if you're registered but you didn't receive a ballot, you can contact your county clerk and request one until October 23rd, 2020, and you can request that through mail. You can request in person. You can have someone go in person to request a mail-in ballot up until the day before the election, I believe. Residents must complete a ballot with assistance if needed and return an official prepaid envelope. So basically, when you get your mail-in ballot, it will come with 2 envelopes inside with the ballot. So there's going to be a ballot and then 2 envelopes. There's a ballot, an inner envelope, which you put the ballot in the inner envelope, and that has the certificate of the mail-in voter, which is what the person will where they sign the ballot or sign the certificate. And then they put that inner envelope, they seal that inner envelope and put that inner envelope in the outer envelope, which can be returned, and there's no postage is required. When you're filling out the mail-in ballot, it is really important that you read your instructions carefully before you complete it. Also, the signature must match the voter registration signature. If it does not, a non-matching signature will trigger a form to cure the mismatch, and the voter must return the form by November 22nd for their vote to count. So basically, if you think your signature might not match because your handwriting has deteriorated, you're not as easy to write your signature has just changed over the years, be prepared. You might be getting a second letter from the Board of Elections telling you that your signature is mismatched and you need to fill out this form to cure the mismatched signatures. Next slide, please. When people are helping a resident complete the ballot, just remember that the resident's vote is always their choice, not anyone else's. And anyone can help, staff, family, friends, but the resident must actually sign the voter certificate. Anyone who helps a resident fill out the ballot or assist them with the ballot must fill out the sister section on front of the inside envelope. Family, friends, etc. can help residents during approved visits, outdoor essential caregiver, compassionate caregiver, indoor visits, pursuant to the latest Department of Health guidance. Each facility should encourage and facilitate family involvement where it's desired. And a sister can help an unlimited number of residents. Next slide, please. So, as I said, all the ballots should have been received by now. They had to have been sent out by October 5th. Ballots sent back by mail, U.S. Postal Service, must be postmarked by November 3rd and received by the County Election Board by November 10th. Ballots that don't have a postmark on them, either the post office didn't put a postmark on or not, they can be received by 2 days after the election, I believe. However, just make sure, we're telling people to get the ballots in as soon as possible so that there's no question in terms of making sure that they're received in time for the election, by that 10 days after the election. Ballots can be dropped off also in secure ballot boxes. There's at least 10 per county. Some counties have more. In addition, the voter can actually take their ballot to the polling place where they can vote in person and deliver their ballots there on election day. The drop boxes will be closed at 8 o'clock on election day when polls close. So you can't drop off your mail-in ballot after 8 p.m. in a drop box on election day. If another resident wants another person to deliver their ballot for them, then that person would become a bearer, and they must fill out the bearer section on the envelope. And a person who is a bearer cannot be a bearer for more than 3 ballots in any election. So someone can't go and collect a ton of 10, 15 ballots and deliver them to a ballot box or to the Board of Elections so you must only have, the most a person can deliver of ballots is 3. Next slide, please. In addition, there is in-person voting on election day. There will be fewer polling places, so a polling place may not be your traditional polling place. Everyone who goes to the polling place to vote in person will be voting on a provisional ballot, paper ballot. The only voters who are not using provisional ballots will be people who cannot fill out a paper ballot due to a disability, and they will be allowed to vote on ADA accessible machines once they confirm that the person has not submitted and returned their vote by mail ballot. Facilities should not quarantine residents simply because they go out to vote. This should solely be based on the resident's exposure when voting. And as I said, there will be fewer polling places, but at least there will be one in-person polling place in all New Jersey municipalities. There is a list of all the polling places on the New Jersey Voter Information Portal at the the New Jersey State Elections website. Next slide, please. The important voting dates, just so everybody knows, October 5th, all the mail-in ballots were sent to all New Jersey registered active voters. October 13th was the voter registration deadline for this particular election. October 23rd is the last day to request a mail-in ballot by mail if you did not receive one. November 3rd, obviously very important, it's actually election day. November 10th is the last day for the Board of Elections to receive ballots postmarked by November 3rd. And November 20th is the certification of the results. Next slide. For generally, if you have never voted before and you registered by registering by mail, and you've not submitted a identification with that registration, you must provide identification when you vote the first time. Such identification are New Jersey driver's license, a military or government ID, a student ID, employee ID, store membership card, U.S. passport, or a bank statement, car registration, government check, rent receipt, something that would basically show your address. because now we're doing automatic voter registration through the Motor Vehicle Commission. Anybody who registers using their Motor Vehicle Commission ID, becomes their ID for purposes of this. So there's not going to be as big of a issue with this going forward, but for now, just be prepared that if you've never shown your ID or given them identification, then you may be asked for identification the first time you vote. And if you don't have that, then you would have to supply that within 2 days after voting. Next slide.
Thanks, Mary. I'll pick up here. Probably one of the most frequent questions that at the Long-Term Care Ombudsman that we get about voting is whether a long-term care facility can assist or should assist a resident with voting if that resident has a cognitive impairment. Our guidance on this is that residents should always be presumed capable of voting unless there is a court order explicitly removing that right to vote. Even people with guardians usually retain their right to vote. It is very rare to see a guardianship order where the right to vote is stripped from the resident. Further, powers of attorney may not vote for the resident. They can assist with the voting and they can assist with marking the ballot, but only the voter can decide their vote and only the voter can sign the ballot. And they have to at least put an X if they cannot provide their complete signature. Next slide, please. The American Bar Association and Penn Medicine have an excellent guide that discusses assisting cognitively impaired individuals with voting. They describe capacity to vote in this way. Capacity to vote is much like the capacity to ride a bicycle, which can be determined accurately only by allowing the individual to mount a bike and start pedaling. If capacity is lacking, the task just won't be completed. Likewise, an individual simply will not be able to make or communicate a choice on a ballot, even with assistance, if capacity to vote is lacking. They further state, a medical diagnosis does not disqualify a person from voting. A diagnosis of Alzheimer's disease, traumatic brain injury, or other cause of cognitive impairment does not disqualify. In short, if a person can express a choice, they can vote. The Penn guidance also recognizes that many long-term care residents have trouble communicating, including difficulty finding the right words, easily losing their train of thought, difficulty organizing words logically. They offer some suggestions for overcoming these communications challenges in a way that is consistent with election laws. Hone your listening skills. Listen carefully to what the person is saying and give them the time to speak, and do not finish their sentences. Repeat information and questions. And if they don't respond, wait and ask again. Time your discussion. Very important. People with cognitive impairments may be more alert and focused at different times of the day. If you do not understand what is being said by the resident, ask the resident to point, gesture, or repeat. For some residents, assisting them with completing the ballot is going to be a time-consuming process. So it really is a good idea to identify staff who are responsible for this task and accountable for its completion. Next slide, please. How can facilities help residents to vote? Well, I touched on it. Designate staff for voting, very critical. Communicate to residents and families, assess residents' needs, set a schedule, and plan transportation to the polls. Next slide, please. Obviously, we are getting late in the process now, so you should have a schedule in place to make sure that all residents have received their ballots, that staff are assigned to assist residents, or that you have arranged for family members to assist the resident if needed or requested. Any employee can help residents who need assistance. It is important, however, that they fully understand how the ballots should be completed, as discussed by Mary in the previous section. And again, that information is also available on the Excellent Voter Portal, which is operated by the New Jersey Division of Elections. Next slide, please. Communication is absolutely key here, as it is in all things. Usually we say that you might want to sponsor activities to create enthusiasm for voting, but it is likely that since this is a highly competitive presidential election, this election has already captured the attention of many of your residents. Some families have a tradition of voting together, so there may be residents who require assistance but who wish to have their family member assist them. Assistance by family members within the provisions of the New Jersey Department of Health Executive Order on Reopening dated August 10th is encouraged. As discussed earlier, family members who are assisting with filling out ballots during indoor or outdoor visits are not necessarily required to maintain the 6-foot distancing while they assisted the resident, but only when they're assisting with the voting process. Otherwise, all of the other requirements are in place. You will also want to have a plan in place to accommodate transportation to the polls or to a drop box, if that is what the resident wants. And you will want to communicate that plan to everyone involved. Next slide, please. You will want to find out who in your facility is not registered to vote and who wishes to vote. Now, obviously, we are past the voter registration deadline, but there will most certainly be future elections, and so there's never a bad time to help residents register to vote. And again, families can play an important role in assisting the resident in voting. You will want to know which residents require or desire this assistance. And you definitely need to find out how many, if any, of your residents will want to go to the polls or want transportation to a ballot drop box. Again, our office has recommended to residents in our most recent newsletter to residents, which I hope you are all sharing, that they fill out their ballots as soon as they get them and send them in through the normal mail the outgoing mail at the facility. But that really needs to be done as soon as possible. Next slide, please. Finally, transportation to the polls. This obviously needs to be planned well in advance, and that's why you need to assess, what residents want this transportation, if any of them. Ensure that the vehicle drivers obviously practice all safety actions and protocols. Reduce vehicle capacity to allow social distancing, one person seated per row or skipping a row in between. Onboard the bus back to front and exit front to back. Open windows. Clean and disinfect the vehicle between trips. And follow CDC guidance for bus transit operators for cleaning and disinfection. Next slide, please. There is some guidance out there other than what we have compiled here. Helping Residents to Vote in 2020 by the American Healthcare Association National Center for Assisted Living offers some guidance for assisted living providers. Again, the ABA Penn Medicine Guide on assisting cognitively impaired individuals with voting is excellent. And there is also Voting Is Your Right by the Boggs Center on Developmental Disabilities that is available at the link indicated. Next slide, please. We are always available if you have questions or concerns. You know our number, 877-582-6995. And if you go to our website, the voting is right, the first thing that you see there on our website, and there is a link to the voting guide upon which this information session is based. You can also call Disability Rights, and they also have a hotline that they're running on Election Day up until the date that the polls close. And again, the New Jersey's excellent Board of Elections portal, this gives you a link to the county boards of elections. That concludes the formal part of this presentation. I know that a representative from the Division of Elections, the head of the Division of Elections, Bob Giles, is on the line. And I believe our colleagues at the Department of Health, I see Stephanie Mosguy and Maria Christensen are on the line as well. So they are available as a resource during the Q&A period. Thank you very much.
Thank you very much, Lori and Mary. If you could, Lori, if you could mute your line for the moment, that would be great. It'll reduce the feedback. Thank you. So we have a couple of questions in the chat already. The first has to do with a resident who has multiple sclerosis, who can't sign his name because he cannot move his fingers. He's alert and oriented, would like to vote. What's the best way to help him accomplish that?
Let me answer that question. This is Mary Saccone from Disability Rights New Jersey. This is an issue we get a lot with respect to people with disabilities where they can't sign, no longer can sign. Generally, the idea is you should be able to make some kind of signature, even if it's using assistive technology such as something through the mouth or they can use their hands. It doesn't have to be their formal signature. The idea is signing. They can sign with an X. They can sign with a line. Anything that would become their signature at that time. In the past, that was a big problem because if there was a mismatched signature, then your vote would not be able to count. But now with the new law that allows for correcting or to verifying mismatched signatures, you will have an opportunity to cure your signature. So if the person can just make a line or an X, then they can send it in. They would say, hey, there's a mismatch. They would be given the form to fill out to verify that they are the person that signed it, and they would sign it again with their new signature, which would then become their signature going forward. So it's a chance for you to cure your signature mismatch. So in this case, if the person can, as I say, just make a line of some type or an X, that would be sufficient to count as a signature. I hope that answers the question.
Yeah, and this is Bob Giles, and great presentation, and thank you for having me on. Just as a follow-up, I think it's important that people understand that their power of attorney cannot sign for them. We do see that a lot where they allow their power of attorney to make that signature, and it has to be the voter, and Mary's absolutely right. If it's a mark, we'll update their signature to mirror whatever their current situation is. Thank you.
Thank you both. Just a kind of a follow-up question. Since this individual in this example is alert and oriented, if he decided that he wanted to go to the polls because he could use the ADA polling machine, would that be another option if the facility could manage to take him to the polls?
This is Giles. Go ahead. From the election standpoint, yes. So that's why every polling place will have an accessible voting machine. So if they are able to get to the polling place, when they arrive, they will be asked to give their information. The poll worker will verify that they are a registered voter in that election district. And then they'll be asked to sign a certification that basically says that due to a disability, they can't vote a paper ballot independently. So therefore, they'll be allowed to utilize the accessible voting machine.
Okay. I apologize for the phone in the background. There is another question here about the number of residents that an assister can help. In the past, facilities were told an assister could only help 2 residents with a mail-in ballot. In the presentation, there was no limit on the number of residents an assister can help. So has something changed recently?
So this is Bob again. So no, and that's a great question because that does create some confusion. Because there's 3 different scenarios when you're talking about vote-by-mail ballots. The first is the messenger. If you needed somebody to go get your ballot for you, in this particular situation, you should have one mailed already to you. But if for some reason you needed somebody to go to the county clerk and get a ballot for you, that's called the messenger. And you can be the messenger for 3 ballots, going to the county clerk and bringing a blank ballot back to the voter. Then during the voting process, you can have an assister, meaning somebody helping you fill out the ballot. That's unlimited. You can assist as many voters as you would like. for that part of the process. And then the third part of the process is returning the ballot. That's called the bearer. And again, that is only 3 people you can be a bearer for. And that includes taking it to a ballot drop box or taking it to the Board of Elections office or to the post office outside of the facility. And it should be clear that on election day, the voter can bring their vote by mail ballot to their polling place, but a bearer cannot. So people really need to understand that if you want to bring your own ballot to your polling place, you can do that, but you can't have somebody else bring it to your polling place on your behalf.
Okay, thank you. The next question is, what if a resident has severe dementia and does not realize or understand what the election is when asked?
I feel like I'm on Jeopardy, but beeping in. This is Laurie. I think the ABA instruction, the guidance is instructive here. If they can't make a choice, then if they don't understand and can't make a choice, then probably you can't process ballot for them. But if they can make a choice, even if they can't clearly articulate, exactly why they're picking, who they're picking, or even understand the long-term implications of it, if they want to fill it out and they can fill it out and they want to make those choices, they can do that. But if they can't make a choice, they don't understand the concept at all. It's a real judgment call, but generally speaking, if they're telling you they want to do it and they want to make the choice, even if you're not exactly sure that they understand why they're making this choice, you can still process the ballot.
Okay, thank you, Lori. Is there a way for residents to check if their mail-in ballots are counted?
Hi, this is Bob. So they can go on to our website, the vote.nj.gov, and sign up for an account that will let them know when their ballot's been issued, meaning sent to them, and when their ballot has been received by the Board of Elections. And if there is an issue with their signature, they will receive a letter giving them an opportunity to cure the issue. As far as the final determination of accepting and rejecting ballots will not appear on that portal until after Election Day. So if they have a concern, they could reach out to their Board of Elections office. And again, that information's on our website. But like I said, if the issue is their signature, they will receive an opportunity to correct it.
Thank you, Bob. The next question is, can a family member drive a resident to the polls to vote?
From an election standpoint, yes. As far as the long-term care facilities, what their rules are as far as people coming and going, that I wouldn't be able to answer. But they can come in and they can assist even if they use the accessible voting machine. They can still get assistance from somebody as well at the polls.
This is Laurie. That's my understanding as well, that the family member can. But the issue of whether you would have to quarantine when you return is dependent on how much exposure that you've had when you were out voting. I know there are people on the Department of Health on the line who might be able to opine on that point, but generally speaking, if they're just going out to vote and coming back and they're following the proper protocols and procedures for safety, they should not have to quarantine when they come back, and they should be able to go with a family member, but it depends on the facts of the situation.
Okay, I know we have some of the CDS staff on the line. I don't know, and as well as licensing. I don't know if Rebecca Greeley or Jason Mayer or Maria Christensen wanted to add anything to that response.
I would agree with that. Basically, if a person's leaving the facility and the other items that are in place with the different directives about reopening and what stage a facility would be in, but just to visit out, they would really be following the social distancing, the wearing a mask, like all of those protocols, and The facility should really do an assessment on that person's possible exposure, but I would not think that a quarantine would be necessarily warranted based on a trip out to the voting booth. And anybody else jump in there?
Hi, it's Maria Christensen. Agreed. As long as the social distancing, the wearing of a mask, etc., is all maintained, and the facility has their own policies, that's fine.
Okay, thank you all. The next question is, what does a facility do if a resident who is not a citizen receives a ballot?
From an election, can you repeat the question again? I'm sorry.
The question was, what does a facility do if a resident who is not a citizen receives a ballot or received a ballot?
I mean, if for some reason they are aware that that individual is not a citizen, we would ask that they reach out to their county commissioner of registration in order to get a ballot, you have to be a registered voter. So that means that individual would have registered to vote, and obviously sign documentation saying that they were a U.S. citizen. So we'd have to do an investigation as to what the situation is at hand. That's kind of a case by case basis. But if they know that the individual is not a citizen, then they would reach out to the county commissioner of registration.
Okay, and similarly, what does a facility do with a ballot that is for a resident who is now deceased?
Same thing. If they could reach out to the county commissioner of registration, so we can update the records, and we do get that where when people become deceased, and if we don't get notification from the health department, then they'll remain on the rolls until somebody notifies us. So we ask that any questions if somebody's left the facility and you got a ballot for them, please let your county commissioner of registration know so we can update the records.
And along those same lines, if there are ballots that are not used, what should the facility do with them? Should they be thrown away? Should they be shredded? What is the right course of action for unused ballots?
So, I mean, that's up to the individual. If it's a scenario where the person just chooses not to vote, you want to destroy the ballot, just so it doesn't, you don't have blank ballots kind of out in the world. And again, that'll be up to the facility and the voter themselves. But normally people will throw them in the garbage if they choose not to vote in a particular election. But we ask that you be careful so they don't end up in somebody else's hands that they should not.
Teresa, are you there?
I apologize. I was muted. This next question goes back to the person who has no ability to use his hands, none at all. Are the ADA voting devices equipped for someone who has no use of their hands? What can be done in that situation? This is an alert and oriented person, but just no ability to use their hands.
So the voting machine, yes, should have the sip and puff device. And also, depending on the individual, we didn't talk about this, but they can get a ballot sent to them electronically, and they could use their own assistive device. If you reach out to the county clerk's office, you can request that, and basically you'll be allowed to download the ballot electronically, vote it independently with your assistive device, but then you would need assistance preparing it for mailing. It still would have to be mailed back. You can't submit it electronically, but you can receive it electronically. So you have two options if you have your own assistive device to bring the ballot into, or you can go to a polling place and utilize the equipment there.
Okay. What happens if a resident received more than one ballot?
The same thing that we were talking about earlier as far as if whether it's deceased or if they receive more than one ballot. Sometimes, especially with older records that we have, older voting records, prior to 2006, we didn't collect all the information we collect now, so we don't have driver's license and last four digits of social security number on a lot of voters. So if they move and they re-register maybe under a slightly different name, we see this a lot with individuals who get married and change their name, or if they move from one county to another and it didn't get picked up. So if in fact you end up with two ballots, we ask that you, again, reach out to the County Commissioner of Registration to update your record, and they'll instruct you, because normally what happens, we'll merge the two records and you'll return one of the two ballots. You'll vote one of the two ballots and then return the other one as to the, and you can return them to the, depending on the situation. If you're just going to put return to sender, please put the reason on there if you're going to send it back to the county clerk. Just return to sender no longer lives here, something along those lines, because the post office, from what they're telling us, won't return something that just says return to sender. It has to have a reason on that return to sender as well. And then you can send it back to the county clerk, and they'll follow up with the Commissioner of Registration. But we always ask that if you have information, reaching out to the County Commissioner of Registration is very helpful for all those situations, whether it's deceased, somebody gets two ballots, there's incorrect information on the ballot for the voter. It'll give us the opportunity to get those things corrected and updated.
Okay. The next question has to do with patients who come into the nursing facility for a short stay. If the time of their stay extends over the period of the election, in most circumstances, they will have received their ballot at their home address because they're not a resident of the facility for the long term. So there's no change of address. How should facilities manage those situations? Should the family bring the ballot to the patient in the facility for them to fill out? What would you suggest?
So in that scenario, yeah, if they're only there short term and they're still getting all their mail and at their house, yeah, if somebody can bring them their ballot, that would be the best. Because they're still allowed, obviously, to vote from their residence. So, but if it's a matter if that's where the ballot is, whatever the best way is to get the voter their ballot, we would recommend that.
Okay. The next question has to do with a family member of a resident with severe dementia. The family member is asking for the resident's ballot because that's how the daughter has done it, quote, for her for a while. Is the facility obligated to give the family member the resident's ballot?
So I guess this starts to get into, and maybe Lori or somebody wants to address this as far as, I guess, how coherent the voter or the individual is. I'm not quite sure what the policies are on that. If maybe Lori, if you want to take that one.
Yeah, I mean, I think what was addressed in our presentation, which is they can't make the choices for the resident. They can assist, them. They can even, help them focus and explain it to them. But they can't just take the ballot and fill it out for them. That wouldn't be, I'm sure you'd agree, Bob, that's not the spirit and intent of the voting laws. So they can't just say, oh, I always vote for her. Here, I'm going to do it, and I'll mail it in or whatever. That you can't do. They can be permitted to assist them with the voting as per the directives that are in place in terms of visitation, but they can't just fill it out for them. So my opinion would be that you're not obligated to just hand them the ballot over in that situation. You should facilitate them assisting the resident, but you can't just give them the ballot.
Okay, thank you. There are a couple of more questions about the use of the electronic ballot. It goes back again to the person who is not able to use their hands at all. The question is, if the person receives that ballot electronically, can the social worker or the nurse or whoever is assisting the resident make a note that the individual is unable to sign, or is there still some expectation that the person makes a mark on the envelope?
We would still, there'd still be that expectation because you're still returning the ballot, so you could vote independently, and then once you print it out, put the mark on there. And then obviously they'll need assistance if that's the case, getting it in the envelope and getting it back.
Mm-hmm. Okay.
So the key with the electronic ballot is it allows the individual to vote independently with their assistive device. So.
Mm-hmm. Okay. Okay, looks like we may have gotten to the end of the questions for the moment anyway. So I'm going to ask if any of you have any closing remarks or reminders that you want to offer before we end the webinar for today.
So this is Bob, and again, thank you for putting this together. The more information we can get out to folks, the better experience everyone will have. One of the things, if you are assisting someone that we see happen on the inner envelope, so if they get their ballot, they're going to receive several things in the packet. There's an inner envelope, a return envelope, the ballot, and some instructions. So when you put the ballot inside that inner envelope, make sure that where they're signing that certificate stays attached. We do have people who detach it because they get confused or whatever, and then we never get that back, or they put it inside the inner envelope. So it says right on there, do not detach. So I think that's one of the things we want to make sure that doesn't get removed from that inner envelope, because that's how we identify and compare, and we know that that's your ballot. And just so everyone's comfortable, before we start counting, that gets detached, and that goes one way and the ballot goes another way, and that's how we keep everybody anonymous and keep your vote private, by separating that at the last phase before we open. But I think that's probably one of the stronger messages, is to make sure that they read the instructions and they follow that carefully. Thank you.
Okay, there are two. Thank you, Bob. There are two questions that just came in. One is, are ballots printed in a language compatible with the resident? I guess the question really is, are ballots available in languages other than English?
So it depends on the county that you're in, and it's as far as the ballots being printed, it's based on the census, and so we have I forget the total number of counties that are English and Spanish. But we also, Bergen is English, Spanish, and Korean, and Middlesex is English, Spanish, and Gujarati.
Okay. And last question is, if a facility is using a video conference to facilitate conversation between the resident and their family member, who's considered the assister in that situation? Is it the family member, since they're the one talking with the resident about filling in the ballot, or is it the facility staff person?
I would say the staff person, whoever's physically filling it out. If they're on a call or like with the family member, but there's a facility person there actually filling in the ovals and filling out the forms, that's the assister.
Okay, thank you for that.
Mm-hmm.
Okay. I want to thank you all very much for taking the time to present today. I think this is extremely helpful, really good reminders and good details for people to use in the weeks ahead to the election. Thank you to everyone who attended today. I hope you all stay well and stay healthy, and we look forward to more opportunities to be with you. So Lori, Mary, Bob, thank you very much. Thank you to the Department of Health, and we will see you soon. Have a good day, everyone.
Bye-bye.
Bye-bye.
Bye. Thanks, everyone. Bye-bye.
Bye-bye.
Thank you. Bye.